significant holes for the county if they were to not be around anymore. But one recommendation that I think has real promise, and I hope you'll look into soon, is the whole notion of intergovernmental transfers, which IGTs are a way that you can work out an arrangement with the Department of Healthcare Services to basically give them some of your local funds so that they can increase their federal drawdown, and then they'll pass that back down to you, and sometimes they'll take a little administrative fee, but we've seen it used successfully in California counties to the tunes of several millions of dollars. So that there's some real potential there for you, because you're not a county organized health system. I'm not sure what the implications would be in terms of the funding. I suspect that would limit your ability to draw down some of those funds, but I think it's something worth exploring, and that there might be an opportunity for some additional funding there.
Is that working with other counties and sharing?
Typically it's working with the Department of Healthcare Services. So they're the ones responsible for drawing down the federal match for Medicaid. Right. So it's something you'll work with the state. And there are plenty of other counties out there who have done this. You can call Alameda County, you can call Partnership Health Plan of California. They have been probably the most successful of anybody I've seen at drawing down the funds. And I know they've had, that their staff have, they'll know the names and phone numbers and people to call. So let's jump over to IT, and IT is just such a critical thing, especially in this day and age, as we all rely so much on our computers. And I don't know about you guys, but when my computer stalls for 10 seconds, I'm shutting it down and restarting it. It's just, I'm used to having technology work quickly and efficiently, and when it doesn't work, it's really handcuffing for me and for an organization. And it's an area that, in doing our review, we not only reviewed your peer counties, but we also reviewed the Gartner reports. I don't know if anybody's familiar with Gartner, but Gartner produces an annual report with staffing standards for a variety of different organizations. And so within our report, we show you what the Gartner standards would say that you should have in terms of an IT support force. And both looking at the peer and the Gartner standards, you're woefully understaffed in IT, and I think it's reflected by the backlogs that you have. And nearly every department we talked to had great things to say about the staff in the IT department. The biggest complaint was that there weren't enough of them. They were stretched too thin, and that's another area of huge risk. If you were to lose any one of those guys over there, I'm not sure how the county would be able to move forward, and it would be very, very handcuffing for you. So we think it's real important to create some redundancy, some cross-training to streamline, to augment your IT staff, and certainly to have an IT manager over there. And that IT manager can be the backup for all of those positions. That person should know and understand the duties of everybody, especially with your database administrators, where it's very complex. You need to have some redundancy there in case there are absences or any issues. And then, of course, there are some physical security and software recommendations that we have. But the end game here really for the IT department is, again, we need to have plans. The IT department needs to take what they've already started and create a formal IT reinvestment plan, a strategic plan, and some formalized policies and procedures to make sure that there's continuity in the event of loss of any of the staff. And then finally, one of the ways that you can help perhaps to fund some of these new positions for the department is to convert the IT department to an internal service fund, which is basically most often called activity-based costing, right? So you're taking all of the activities that the IT staff do, and you're allocating those activities back to the consumers, the departments that are actually using that time and those resources, and you also allocate the overhead of the department back to each of the departments.
What did you call it? Activity-based what?
Activity-based costing.
Costing. Thank you.
So that's just, there are other ways to convert to an internal service fund, but that's probably the most prevalent. So let me jump over to Public Works.
If I may, Mr. Chair?
Sure.
Sorry to interrupt. One of the things I want to mention to the board is that we have done interviews for the IT manager position, multiple sets of interviews. We have not found anyone yet, hence bringing the new job spec, the IT supervisor, to your board at our last board meeting, or prior meeting, I don't remember now. But we definitely do need to have some supervision and some oversight. And so I just wanted to make sure that the board was aware that there has been work with that. Definitely a need to have more staff in that office.
Mr. Chairman, I was just showing Supervisor Barrios a message I had from my sister, and she said you were in trouble with her, and because of the IT, I guess they had their phones, some sort of system down for 2.5 weeks. And we do need these folks, but the challenge comes right back to having the money.
Yeah.
You know, and putting the staffing on. A couple weeks ago, we heard, from the sheriff, and I think you're absolutely right. Compared to some of these smaller counties, the research I've done is that we have half the IT people that a small county has.
I would even say less than half. I mean,
Yeah,
our neighboring counties are in the hundreds. I think it was 140, the last count I have. Santa Cruz is well up in that range as well. So, when I first came on board, there were only 3 people, including myself. And we have to cover all aspects and do the same thing that those counties have to do, and supply the same mandated software and updates and so on for their respective departments. So it's definitely we're definitely not where we should be. But obviously when the IT department was created, if you remember, it was created right when the downturn started. And the infusion of funding for that office didn't occur, and there definitely needs to be a mindset of investment, future investment. I mentioned that to you on more than one occasion. I think when we're looking at new development and other things, I mean, these are things we have to address. Definitely important for the county.
And so 2 add-ons to that, again, the internal service fund would allow you to also charge back some of the grant programs that you have and to kind of really disperse that funding and maybe generate some additional funding. But more importantly, though, think about the loss of productivity. I mean, your sister's story is just one example, and we didn't delve into a lot of the examples that we heard, but we did highlight some of them, just anecdotes in the report, about folks who are starting but don't even have a computer right away. That kind of thing happens, and when the phones are down, what is the loss of efficiency and productivity? If you want to be a world-class, top-notch county that provides the best service to your constituents, you need to have a robust and exceptional IT infrastructure and capability. So I think that the productivity gains will certainly match, the expenditures. So I think it's a real high priority area for you.
And one thing is I just was made aware of that this morning and addressed that this morning. So, we're wearing a lot of hats in this office, but we know that that we have to provide those services and we have to get on it and deal with it. So, but again, it does cause issues for staff. So.
Yeah, so Public Works. So the primary recommendation here is that we'd like to see merge the Public Works and Planning and Building departments. They work together quite often. I think it's a good time to do so. It would enable you to increase the span of control. I think they're You know, they're both fairly small departments, would provide you some opportunities for cross-training and for sharing of, you know, administrative resources and for sharing of technologies and systems. You know, the project tracking systems are needed and so on. I don't want to go through all of these unless there are specific questions, but one here is, you know, there seems to be a trend around the country to outsource building grounds and maintenance. Oftentimes, the private sector can do it cheaper, and one of the things that we heard in the county is that that's a difficult area to staff. And so by outsourcing it, you're placing that burden on your contractor, who might have a quicker ability to hire and to, you know, deal with vacancies or illnesses and so on. Certainly there are some sensitive things like the prison that you probably need to keep in-house, so we're not suggesting that that department you know, go away. We'll want to have somebody who oversees the outside vendor, but we think it's something that you should at least do a cost analysis on and see if the numbers make sense. And then, you know, continuing your efforts to identify and pursue additional grant funding. Just wanted to add a caveat there that, you know, that's assuming that, you know, we don't want to chase every grant. We want to focus on those things that support the vision and mission of the county. And then planning. Again, you know, this is another area, and planning is always, planning and training seem to be the two, you know, when you have a downturn, planning and training, right? The first two things to usually go away, and you know, as you start to get into recovery, you know, certainly planning is going to be key, and we think that, you know, with the age of the infrastructure that you have, especially in like the public health building and some of the other facilities, IT building in particular, you know, we'd like to see you prepare a 5-year capital improvement plan instead of a 1-year capital improvement plan. And again, as I mentioned earlier, you know, a central project tracking system and management repository would be beneficial not only for public works but also for planning and building. I'm rolling through pretty quick. Are we going to save questions till the end, or do we have any? Okay, I'll keep rolling then. So integrated waste management. So integrated waste management basically is a potentially 2-person department, and we'd like to see it merged with environmental health, public works, and the planning and building department. And that's what I was talking about earlier with this kind of concept of a community resources agency. You're putting all these community resources together. They all interact. They all work together. This is an opportunity to share the resources, you know, the administration, the fiscal resources, to standardize policies, to, you know, create formal communication and collaboration mechanisms. And there will certainly be some accounting maneuvers that will need to take place in the finance office, but we've seen this model in other peer counties as well as around the country, and you know, provides the opportunity to save money on buildings and infrastructure and copy machines and so on. The next two are kind of around your diversion practices. You know, there's a real opportunity to adopt a higher standard for diversion and to charge fees up front, which would help you to more, you know, give the builders, you know, a real incentive to comply. We understand that they've been exceptional at complying anyway, so this may not be a real issue, but when we look through the best practices for diversion and waste management, charging the fees up front was right near the top of the list. And of course, you know, when you're thinking about your landfills, the more you can divert away from your landfills, the better off the county's going to be in the long run, because you're not going to have to keep closing sites and reopening new cells. And there are also opportunities as you divert more waste to, you know, generate additional revenues, or at least to make it cost neutral and again, save money on your landfill. And again, succession planning here, you know, there's just a tremendous amount of knowledge and passion with your director in integrated waste management. And you know, we need to have a contingency plan there. And so being part of a larger organization where there was another director there who would be informed about some of the key matters and who could begin that learning process, and to bring in an apprentice and some shared resources, you know, fiscal folks that are starting to learn kind of the finances of integrated waste management. I think that's going to help to mitigate your risk in the event of you know, that loss of knowledge. So moving on to planning and building department, again, you know, we'd like to see it merge with public works and integrated waste management and create that larger community resources agency. But we also saw, in comparison with the peer counties, that there were far fewer folks working in planning and building than we saw in other counties, and especially with all these new developments coming online. And the number of permits has really jumped in the last year. That you know, there's an opportunity there to increase staff. And when we talk about your building inspector position, right now it's kind of bifurcated, where you have a half-time county person along with a contractor. And while the contractor's fees seem reasonable, they're not outlandish, you have enough work there to have a full-time county building inspector. And there really, we believe, needs to be somebody who has that ultimate authority and responsibility. There's still a little bit of a back and forth between the contractor and the county person, you know, because the county person is only part-time. He may go out and inspect a property and write them up for a couple things, and then the contractor comes in next and says, oh, that's okay. And so they're not always on the same page, which probably will never change, even if you bring it all in-house. But you know, there needs to be somebody who has that ultimate authority. You have enough work to bring it in-house, so we think it should be brought in-house, and that we should move the contractor into kind of an overflow role. So let's staff the county to handle the workloads that you have, move the contractor into the overflow mode, to where when you get these 6,000 unit developments and all of a sudden you're drinking water through a fire hose, you have this contractor that you can rely upon to get you through that anomaly. And again, IT and equipment plan is recommended, policies and procedures and performance metrics, which will again help provide a barometer for you to be proactive in dealing with these upticks in volume. I know I'm missing a key point there. Byron, what did I miss? So in summary, and again, I encourage you to read our full report, that is the results of our performance review. This slide has all of our contact information, and then it's not in your packet, but I did, we do give some examples in here of some of the performance metrics that you might want to consider as a starting point. And we recommend that you start small with performance metrics, get a handful of key ones, get good at those, and then as your systems become more sophisticated and robust, then you can expand, you'll know. But in the actual report, we also, and I know it's really hard to see on here, but we give you a visual of what this community resources agency might look like, and we think it can be a real asset for the county. So with that, any questions?
Hey, Mr. Chair, I have a question.
Supervisor Rivas?
Yeah, I'll try to make this quick. And I know when we had talked about this concept and this whole idea, I believe at our board retreat, I'm like a year ago, I don't even know, when I'm starving, brain's falling off. Okay, yeah. So almost a year. And I know that we had talked about it becoming a very transparent process. You know, we certainly didn't want this process to be used as a way to put fear into our workforce, obviously. And I know that you had mentioned that there was some outreach done to department heads. Was any effort made to talk to local employees, you know, like our labor groups? Because I know that that was mentioned in our board retreat, and that was, you know, that's something that's very important to me and some of my colleagues as well.
No, we limited the review just to county staff.
County staff.
And-
And so how many times, if you can recall, was contact made between you guys and those department heads?
You know, it really varied. In some cases, there were a handful. In other cases, just a single contact, you know, with a meeting. It just depended on you know, some folks were real quick about getting us the information that we were asking for. Some folks we didn't have any follow-up questions for. Other folks we had both. And so it varied, but for the most part, it wasn't more than just a handful of contacts. But you're right, though. You know, there was, I developed a very scripted, you know, spiel, I'll call it, that I tried to say verbatim every time we sat down with somebody, because we knew that there was, you know, we could tell there were some people that were very nervous about meeting with us, and that's not unusual. I've experienced that many times over my career, and so we tried real hard to put folks at ease. Whether we were successful or not, I would say my guess is we were largely successful, not fully successful, but the end result was we still felt like even the folks who didn't fully get over their uncomfortableness, they were still forthcoming, helpful, and so I can't say enough good things. It seems like you have a really great staff out there, a lot of really dedicated folks who really care about San Benito.
Thank you.
Supervisor Rivas, let me just clarify one thing. While Optimity did not do that, as this got started, I actually did get a couple of calls from employees and told them this was preliminary. They were looking, nothing, there would be many more discussions prior to actual changes being proposed in specific detail and or approved by the board. But I also did talk with SEIU, not with the other labor unions, but with SEIU specifically on at least 2 different occasions, just to let them know this is moving forward. There's a lot of discussions. If you get calls from your members, give me a call. If there's an issue, we'll try to clarify it. There were no formal meetings, because what we had said is, as things move forward with this study, if there are changes, we obviously will then have to move into dealing with those changes and talking to the unions in a formal sense, depending on what changes may or may not happen.
Sure. Okay. Good question. Thank you. Any others?
I just have a comment, Mr. Chair.
Rosemary?
Yeah. At the CSEC conference, there was a lot of talk about that we work in silos as counties, you know, the departments. I noticed that you are recommending that some of these departments come together. Where do you see the state moving as far as your experience when departments merge like this? And I'm talking primarily funding, because we get funding for certain social services, for example, and that come through behavioral health, but all these clients kind of cross over to different departments. It's probably the same thing with planning and public works. You know, we have clients that cross over. So how do you see that as being a challenge with the state of being able to do that and still having to keep all the funding for these certain things separate from others, whereas that client has a greater need to be able to address many social needs?
All right, well, again, that, you know, keeping the funding separate is, you know, primarily an accounting function, but might also necessitate, you know, some changes in the way that employees keep track of their time, right? But you're dealing with a lot of that already, because you have different funding programs within departments already, so I wouldn't anticipate it would be any different.
A major change. Primarily, you would see a change in being able to utilize people for a greater benefit, greater outcomes of providing service.
Right. And, you know, again, when we looked, you know, and you'll read in the report, and I mentioned some of them today, you know, cost savings is always, you know, one of the primary goals of these kinds of consolidations. But when we looked at your county, because you have so many small departments, it was really, we were looking for synergies. And you know, what we've seen in other organizations in other counties, especially when you have all these initiatives going on, you have, you know, healthy families transitions, and you have, you know, Medi-Cal expansions, and you have duals demonstration projects, and you have all these projects going on. They all end up getting siloed within different organizations, and by, you know, having a broader organization that has a better communication and collaboration structure, oftentimes you don't see those kind of silos as much, because there's better coordination and cooperation between the different initiatives. So it has benefits not only on a day-to-day basis, but also on special projects and different types of initiatives. And again, you can't underestimate the benefit of cross-training and sharing of resources and sharing of physical infrastructure and so on.
Thank you. Thank you, Mr. Chair.
Yeah, there's a lot of details here, and I have a lot of questions, and I think, you know, we're not to decide anything today, and we got this report we got to go through, and I want to have a better understanding as on the peer comparison with our county and how they accomplish that fiscally, and we're not getting there. And then we have to decide, you know, how if we move forward with any sort of this reorganization, maybe prioritize which ones would provide the highest cost savings and is pretty much more doable, and then systematically over a period of time address it.
And Mr. Chair, if I may, and that's exactly what we would be requesting of your board, is to direct staff to actually move forward with that, looking at what would be a cost benefit from an efficiency perspective, synergy, succession planning perspective, and then coming back to your board with more detail with that, and then asking for either us to move forward or not move forward with that.
And, you know, if I may suggest to the, probably next year's future chairperson to maybe on a, you know, we looked at, what, 5 different consolidations this afternoon. Maybe identify one and go through it, you know, with greater detail, address the, you know, the cost savings and reorganizational structure, because I'm having a hard time following, you know, if you did merge, say, planning and public works, you know, what would that structure look like with the staffing that we have available today compared to, you know, what's being proposed for future. And so,
We'll take a look at the appendix, where we've kind of laid out what it would look like given the existing staffing that you have, and we would.
It's in here.
It is in the, well, it's
Okay,
not,
good.
it's in the bigger report.
It's in the 85
report, in the-
page
in the
report.
appendix. And we would certainly recommend that you make the decision on any consolidations before you look at any additional staffing, because once you consolidate, you're going to find, you know, that
oh
you're.
yeah, you'll find some holes.
Well, you're going to have some resources that you can share that are going to take some of the workload off of people who are overtaxed, right?
Okay.
Because you have some departments that have a full-blown fiscal administrative unit and others that don't. So they've got people wearing multiple hats. But we're happy to be a part of any dialogue going forward. We are your advisors, and these are our recommendations. And so please coordinate through Bianca and Ken and I are happy to get on the phone with you or to meet with you, and to get anyone else within our organization involved to help you work through your questions and issues. Okay?
Thank you.
This is not the 80-page report? This is the.
That is
80-page.
it. Yes, that is
Okay,
it.
So we
Thank
have it
you.
in hand already.
You do.
So we'll be able
Yes.
to-
This is what
Yes,
we're
and-
looking for.
This is what we were, and you'll have the.
And color version would make it much more readable. You do have an electronic color copy, so I don't know if you have color printing capabilities, but it'll make some of the charts and graphs a little easier to read.
Okay.
Thank you.
I want to open it up to the public. Is there anybody from the public that'd like to speak on this?
I will be very quick. I know you've had a long morning. You're very tired and probably very hungry. I just want to point out a few things, and I'm glad to hear that you're going to bring this back where we can have a lengthy discussion on it. But first off, their contract has expired in July. And so I don't know how you're going to move forward with payment if it's been extended and it wasn't done at a public meeting, but I think that needs to be addressed first. And then I'd like to know how these departments were chosen, why these were the most important. And on the behavioral health and human resources, HSA, I'm as exhausted as you are. You had a senior department head in here less than 2 years ago making this suggestion, and the board shot it down. And we've looked at a lot of these consolidations in the past, and they've decided not to go anywhere because of cost, different things. And I think whenever you enter into something like this, you've got to be really careful, because I believe that we have some of the best department heads and best employees anywhere. And when you bring in somebody from the outside and you've already discussed these with your local department heads and local employees, and you haven't taken what they said is serious, or you've decided not to do it, you're kind of minimizing their efforts. And I think it's really important that as you move forward, and it's a very transparent moving forward, you involve your unions, you involve your department head, and you allow them to speak freely. Because what happens, as you all know, when you get up here before the Board of Supervisors, they're intimidated, and they don't want to really say what they feel. So I don't know how you're going to get over that hurdle, but my fear is that you're going to lose some of these very qualified people that have stood up in the bad times and worked many, many hours overtime, and now feel that they're being ignored or they weren't taken serious. And you've got to, you can't bring people into this and make it work if they're come in kicking and screaming. You've got to have them on board, and everybody's got to be on the same page. And I would just really advise you to think about that, because that is extremely important. You have to work as a team to make any of these things work. Thank you.
Is there anybody else that'd like to speak to the board on this item? Seeing none. I think you have your marching orders. I'd like to announce to all the people that just arrived for our 1:30 session, we have not had any kind of noontime break. We started at 9 o'clock and we've gone straight through. So what's the wish of the board? 15 minutes?
A 15-minute break would do.
Okay.
We're really hungry. We can eat in 15.
We're taking a 15-minute break, and then we'll open up the public hearing